Hi, I am Dr. Bruce Knolmayer. I am a member of Georgetown Orthopaedics at MedStar Montgomery Medical Center. Well, I've wanted to be a doctor practically my whole life. Actually, it dates back to when I was in second grade, so it was quite a while. I initially started out as a general surgeon, and as I rotated through orthopedics, I had so much fun, and I liked the patients I was dealing with, the procedures that we were doing, and I ended up switching over to orthopedics after that. I have two different fields of expertise. I'm a general orthopedist, so I will see all different types of patients' issues and problems. My first focus is on joint replacement, so I will treat patients who have arthritis in either the shoulders, the hips, the knees. We start out with a conservative approach, and in many cases that will work for quite a while. There are times then, if that is not effective, then we will start discussing whether or not we need to proceed with some type of surgical options for that patient. The second field that I also focus on is sports medicine. I do a lot of arthroscopies, so I will scope patients' shoulders, knees, sometimes other joints as well, to help underlying issues to whether it's the rotator cuff in the shoulder or the menisci or ACL within the knee. I was trained to be conservative. I treat patients very conservatively, and it usually works. Whether that conservative treatment is exercise, including a course of physical therapy, whether it's medicines, whether it is injections. In many cases, you see your patients getting better. There are instances where I would then have to talk to them about proceeding with surgery, but to me that's a last resort. Certainly there are patients that come in that would need surgery a little bit more urgently, and that's usually the exception, and if that's the case, then we talk to them about that as well. And as I do treat my patients, I try to picture them as if they're one of my family, or if this is me sitting there. It's a very anxious time for them in many cases, so I try to reassure them and treat them as if I've known them before I've actually had met them that day. I've been in practice for 17 years. When I first started, this hospital was known as Montgomery General Hospital. It was your small country hospital. When MedStar came in several years ago, they were able to provide extra funds to, I think, strengthen the hospital, to build up support services. They've increased the physician network to the point that there's a lot of physicians available to our patients in many, many different fields. I think they've strengthened the nursing care here at the hospital, and I think they've just really been able to influence to the point that there's a much better system here at MedStar Montgomery Medical Center.